Healthier Together is a very important consultation about changing hospital services in Greater Manchester. It proposes that there will be two types of hospital: specialist hospitals and local hospitals. Local hospitals will lose services to start with, such as acute and complex surgery, but in due course they could also lose inpatient paediatrics and consultant-led births.
We're very proud of our maternity services and wish to continue to deliver a high standard of care to our women in the future. In order to do this, we need to maintain the links with all the specialist services, which is why we strongly believe that we should be the specialist hospital for our sector.
In our trust at WWL, we provide specialist trauma unit status for patients sustaining multiple injuries. We were awarded this status due to our high levels of care in treating multiple injured patients, and a recognition that due to geographical factors, patients could not be rapidly transferred from our area into the central Manchester hospitals. Our second role as a specialist unit in Greater Manchester is that we provide the regional Northwest Pelvic Trauma Unit. We therefore have patients who are admitted to all hospitals, not just in Greater Manchester, but throughout the northwest of England, who are transferred to WWL for their specialist pelvic surgical treatment.
We already provide a high standard of care for our surgical patients, be acute or elective, and it will be a shame to see those patients travelling miles and miles away from Wigan and Leigh to get the same care which we currently offer. We have the expertise, we have the backup services, and we have the skills to deliver what Healthier Together is proposing. So the case is already there that Wigan needs to be a specialist hospital, and what we need is the support of our community and the hospital staff to fight for this case.
What is this going to mean for our patients, for our public, for our nursing teams, for our medical teams? Patients are extremely worried. They ask us each week about these questions. They read it in the local newspapers, they see it on the press, and they want to come to us for their treatment. We've set some of the highest standards in the UK for our A&E targets, for our advancing quality, and why should this be taken away from us? Why, as providers, can we not care for the people who want to be given the care by us?
That the public of Wigan and Leigh deserve the best possible medical service, and I believe that the only way we can do it is if we remain or we become a specialist hospital. I would not like the services in this part of our borough to deteriorate, and I suspect and I worry that that might well happen if we are downgraded.